And a new approach to a routine blood test could predict a person's 30-year risk of heart disease, according to a study in the New England Journal of Medicine. 30,000 women participated, and of that, around 3,600 either died or had surgery due to a heart disease-related issue over the 30-year follow-up period. Doctors in years past have checked for heart disease by using a blood test that examines cholesterol levels. But experts say limiting the blood test to just cholesterol misses out on catching some silent risk factors. The lipoprotein a test measures the lipids, which are the different types of fats of cholesterol in the blood. Lipoprotein a is similar to LDL cholesterol, according to Dr. Keith Ferdinand with Tulane University. However, he says the added protein makes it much more dangerous.
And it's genetic. It's not related to being overweight or eating too much fast food or fried food. It's related to the liver actually making this substance known as lipoprotein a.
Dr. Ferdinand says the lipoprotein increases your risk of heart attacks, stroke, peripheral artery disease, the blockage of the aortic valve. He says he encourages ethnic minority groups in Louisiana to get tested for lipoprotein a.
Because it appears to be higher in people of sub-Saharan African descent. It's also higher in people of South Asian descent and may be higher in certain Hispanic populations.
Dr. Ferdinand says the test is FDA approved and recommends you ask your doctor specifically for the test. He encourages all who have family history of heart disease to get the test and monitor your cholesterol levels. Ferdinand suggests getting tested for lipoprotein a as early as 6 years old. He says at this time there is no treatment, but preventative measures for other medical conditions can be taken.